So my name is Dr. Mogeni Richard. I'm an obstetrician gynecologist with interest in infertility. Just recently completed my training under the program of Merck Foundation More Than movement from University of Valencia through IVI, where I did MSc in the Biotechnology of Assisted Reproductive Technology and Embryology. I work at MAHE Teaching and Referral Hospital, which is a public hospital within Uasin Gishu County in the western part of Kenya. And I also do part-time practice at Fountain Healthcare in the same town. Yes, I want to say that the course was very informative. It was a bit hard, but manageable. The content was heavy and deep because it really involved a lot of basic sciences, especially on embryology. But the faculty was up to task. They did a very good job, even though the course was online, majorly maybe due to COVID kind of situation at that time. And we managed to pull through under very difficult circumstances at that time. Yes, this course was godsend because it came at a time I had developed a lot of interest in infertility. Our women in the public sector were really suffering because here in Eldoret, we do not have a public facility IVF or fertility doctors dedicated to helping the public patients. We have got private facilities around which are offering assisted reproductive services. But when I joined the course, I thought it was wise that we start clinics for infertility patients. To my surprise, I realized that when the clinic had traction, we were having bookings of 20 to 30 patients per booking. And initially I had started a clinic once a month. We were forced to split it into twice a month. And it has been such a heavy clinic because I am voluntarily running it outside my other duties in the institution. But it has been so successful to the level that even some individual donors have spotted this opportunity. Like we have a donor from Indiana University who was offered to be giving us 500 USD every year towards the infertility patients, especially those who cannot afford investigations and partly, basic treatment. Also, when I underwent this course, I pushed for the hospital management to start thinking of establishing a public IVF lab. And though with a lot of difficulty, we managed to do a proposal, which is currently with the Ministry of Health of this government. It's dragging a bit slowly, but we hope for the best, and we hope that we'll maybe in the near future also get other partners who might see the special need for this kind of women. In MTRH, also basic infertility facilities like an andrology lab have been a challenge, and we've been trying to identify a space to establish that. I wrote to management to identify a space, and we are at an advanced stage of getting a space where we can have our men and where we can be able to do IUI procedures for the organization. And we've also tried to discuss with the university so that to improve on infrastructure, we may probably need to begin a program of training on RAY. I do teach also at the university, and I do conduct continuous medical education for the public and also for the residents who are currently doing their postgraduate program. We do hope that once there is a curriculum, then we'll have an organized way of even also the resources and the infrastructure will follow. But our major aim is that this will happen. In the private sector, we have our IVF labs in one of the institutions around. But it's not easy because it's private. It's quite unaffordable. But for basic procedures like IUI, we are also able to do them in the facility where I'm doing part-time practice here in Fountain Healthcare. I'm now focused on my career. I had an interest in infertility, basically because of the suffering these patients were going through. Being seen by generalist doctors and everyone prescribing what they think they should. But now I have focus, and every day, everything that I do is towards improving this career. And I believe to learn more and gain more. And apart from being a gynecologist, now I have started having that feel of being a fertility surgeon. This will greatly benefit the country because of that and because of the needs that have been identified. You know, now we have an advocate who's identifying the deficiencies in terms of human resources and also in terms of infrastructure in the institution. So that has helped me to even learn more on the needs, especially what we need to do, the various procedures that we need. It helps me, the training helped me in terms of identifying, when we were doing the proposal, identifying the infrastructure that we need for the IVF lab. And for the public, I have very encouraging feedbacks from the patients. When I miss the clinic, I receive phone calls from my patients that, we missed you because there's a plan we had. Infertility requires that sometimes you adhere to some protocols. There's a plan we had, but because you are not there, there's this problem. But what we are doing, we are also mentoring other colleagues who are interested so that they can be able to support this kind of service. So I believe that the patients are benefiting. I believe that this country is benefiting, and I'm very much grateful to Merck Foundation, especially identifying this as a special need. Many of these women, in terms of consultation, they require a lot of attention at the time. It's not the usual consultation of 10 also minutes. One patient can take 30 minutes because you have to convince them why they need to adhere to some protocols and why they need to do some things in the way that you want. I believe that we have had a few success stories with the patients. They have been able to give feedback that they have succeeded. The latest is one I saw yesterday, whom we are now following up for the pregnancy. Had looked for a pregnancy for 9 years. She had what we call polycystic ovarian syndrome, but I had never had special attention specific to that kind of diagnosis. So this is a very important cause. I have actually shared with a number of colleagues within our catchment area and beyond. The catchment area for us here as Moi Teaching and Referral Hospital, or rather Eldoret, is over 22 counties because the greatest institution we have around is a teaching and referral hospital. And there are colleagues who are interested. I have sent referrals to colleagues as far as Kisii County, Homa Bay County, Kisumu County, for those who are interested. And we've done this because this course, when we were doing it at that time, it was from the comfort of your protected time, even though we hope that we might have an opportunity to go on site for some further support and training. And most colleagues will like such kind of a situation because of the kind of work design and arrangements that they have in place. So we will, and we will continue to encourage more to do, because also it helps patients that you have a common language of communication on how patients are managed. Yes, I am forever grateful to Merck Foundation for the opportunity. When I applied for this scholarship or training. I was doing it because I had just gotten it through some online sharing. And initially it was very catchy and I didn't know whether people would be interested. I just threw an application. And the one thing that I got encouraged is that, I didn't have to pester Merck Foundation. They just identified me independently and gave me this opportunity to learn. I'm very grateful for that. And I'm also grateful that we have got this kind of situation. They gave me a chance to travel to India for the alumni kind of conference. And we interacted with many people. I believe Merck Foundation is making an impact in the lives of many, many human beings, especially in Africa, who have problems, and special problems which are essentially neglected by the governments and neglected by even the practitioners themselves because of the resources involved. So once again, I need to thank Merck Foundation for the opportunity. I will make one request that considering that we did this training through audiovisual, through online learning, that as we grow in the practice, they give those of us who did that online training a chance to pursue on-site training so that we up the skills for the benefit of the public. Thank you.